Welcome back to another episode of Drug Talk, everybody. In today's video, I want to quickly go over 3 things that you should be aware of before using Diovan or Valsartan. Number 1, when you start using Diovan, there's a chance that you could experience low blood pressure or hypotension. In terms of percentages, 5.5% to 7% of patients will experience low blood pressure while using Diovan. Some patients may experience what's known as orthostatic hypotension or postural hypotension. This is when you have a sudden drop in blood pressure when going from a seated to a standing position. Orthostatic hypotension is associated with an increase in adverse outcomes such as syncope or fainting, falls, or cognitive impairment. Hypotension in general is more likely to occur if patients are also using other medications that lower blood pressure, like diuretics or water pills. Number 2, patients who use Diovan may develop a cough. Just over 2.5% of patients who use Diovan may experience a cough as a side effect. This class of medication that Diovan belongs to, known as the ARBs or ARBs, is less likely to cause a cough when compared to another class that is similar, known as ACE inhibitors. Oftentimes, an ARB is the go-to choice when a patient experiences a cough with another type of medication. It should be noted that the cough is not dangerous and shouldn't be a medical concern for you unless you find the cough very troublesome or you have another chronic condition in which this medication is making your pre-existing cough worse. It's also important to be aware that taking Valsartan or Diovan may increase your risk of upper respiratory infections such as the common cold. And number 3, when you start Diovan, you may experience dizziness. Dizziness can sometimes be a common side effect with Diovan, happening anywhere from 2% to 17% of the time. Due to this side effect, it's important to be careful when doing things like driving or operating heavy machinery until you know how the medication makes you feel. For many patients, the dizziness may subside after taking Diovan for a prolonged period of time when your body gets used to the medication. Often, patients experience this dizziness when they stand up too quickly, so while on this medication, standing up more slowly may be beneficial. It may also be beneficial to avoid going from a lying down to a standing position rapidly and instead go from a lying down to a seated position prior to standing. And that's all we're going to talk about today with Diovan or Valsartan, but before you take off, I wanted to quickly let you know that you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.